Hi, I'm Sylvia Azania, and in this video, we're going to talk about oligoasthenozoospermia. We'll explain what it is, its causes, its possible treatments, and we'll also answer some frequently asked questions that users may have related to this topic. Oligoasthenozoospermia, also called oligoasthenospermia, is defined as a sperm alteration consisting of a combination of the following conditions: oligospermia, a low sperm concentration of less than 15 million per milliliter; asthenospermia, impaired sperm motility, where more than 60% are immobile or less than 32% of sperm have progressive motility. And here it's important to note that although the World Health Organization published an update to the laboratory manual for the examination and processing of semen in 2021, constituting the 6th edition, the truth is that it's most common to continue following the criteria of the 5th edition from 2010. In short, men suffering from oligoasthenospermia have a low sperm count in their semen, and additionally, they don't move properly. The consequence of this sperm factor is that the chances of sperm reaching the egg to fertilize it are lower, which delays a natural pregnancy and causes male fertility problems. And before continuing with the content of this video, I'm going to ask you, please, if you're liking it, to give it a like and subscribe to the channel if you haven't already, because it helps us continue and ensures all the information we publish can reach more people. It's difficult to establish the exact cause of oligoasthenozoospermia, as it usually goes unnoticed by the man until the moment he tries to achieve a pregnancy with his partner. Despite this, we're going to discuss some possible reasons related to the decrease in seminal quality, maintaining bad habits such as the consumption of tobacco, alcohol, or other drugs, exposure to environmental toxic agents, infection in the seminal tracts, not following a healthy and balanced diet, cancer treatments, radiotherapy, and chemotherapy, hormonal disorders, trauma to the testicles, testicular alterations such as varicocele, and genetic diseases like Klinefelter syndrome or Y chromosome microdeletions. It's also possible that alterations in seminal parameters originate from a combination of several factors. Any factor affecting spermatogenesis, that is, the process of sperm formation in the testicle, could cause oligoasthenozoospermia or other seminal alterations. Depending on the degree of oligoasthenozoospermia and whether or not other fertility alterations exist in both the man and the woman, the appropriate treatment to achieve a pregnancy can vary. In principle, oligoasthenozoospermia has no cure. However, in milder cases, lifestyle changes like a healthy diet, quitting bad habits, moderate exercise, and taking vitamins and antioxidants can improve sperm quality. Conversely, if oligoasthenospermia values are more critical, or if natural conception isn't achieved, the couple will need to turn to fertility treatments to try and get pregnant. Basically, there are 2 assisted reproduction treatments suitable for these patients. Artificial insemination. This would only be indicated for mild oligoasthenozoospermia, as a minimum sperm quality is required to ensure success. The post-wash motile sperm count must be at least 3 to 5 million. Additionally, there are requirements the woman must also meet, such as tubal patency. IVF-ICS is usually the technique of choice for patients with moderate or severe oligoasthenospermia, or when artificial insemination isn't possible or has failed. It involves micro-injecting sperm, selected under a microscope, into the eggs retrieved through follicular puncture. Thanks to in vitro fertilization, many barriers in the male and female reproductive tracts can be overcome to achieve pregnancy. Furthermore, ICSI even allows for the fertilization of eggs with completely immobile sperm. The only requirement is that their integrity is intact, meaning they aren't mistaken for dead sperm. And now we're going to answer some of the most frequently asked questions users may have regarding this topic. Can acupuncture improve severe oligoasthenozoospermia? Acupuncture could show benefits for both male and female fertility, provided it's performed by a professional. Therefore, an increase in sperm quality is possible for some men after this type of treatment, while maintaining healthy habits. In any case, if sperm quality is severely affected, as in severe oligoasthenozoospermia, it's unlikely that sperm quality will increase enough to reach values considered normal. Can Omifin treatment cure oligoasthenozoospermia? Omifin contains clomiphene citrate, a compound that increases the production of FSH and LH hormones. In men, these hormones function in the testes, increasing testosterone production and stimulating spermatogenesis, which is the production of sperm. For this reason, Omifin might be prescribed by a specialist for certain cases of male infertility due to hormonal causes, but the truth is that it's not very commonly used. We'd love to hear about your experience, so I encourage you to tell us in the comments.